Good evening, my name is Sandy, and I will be speaking a little bit about borderline personality disorder for homework purposes for my graduate class, Abnormal Psychology with Dr. Modisett. Have you ever met a sweet, charming, bubbly, friendly person, and the next minute, for no reason, they turn jealous, angry, controlling, over-emotional in a splitting second? Well, they could be suffering from borderline personality disorder. To them, things are either black or white. You either love me or you don't. You either care for me or you don't. 75% of the patients are women. They tend to attach themselves strongly to others. They become very angry when they believe they're being ignored or mistreated. They usually have rocky relationships because they imagine abandonment, causing them to check their spouse's cell phones, emails, or car mileage on a daily basis, always looking for evidence that the spouse is cheating or imagining evidence. So they tend to hallucinate things. Some of the causes are in childhood, lack of good parenting, sexual abuse, the absence of one parent can also be the cause. I would like to speak a little bit about the history. It goes back to 1938. The term borderline was first adopted by the psychologist Adolf Stern. And at first, they thought it overlapped with schizophrenia, but because they do have hallucinations also, but it did not meet all the requirements or classifications for a schizophrenic diagnosis because they didn't have all the classifications for neurosis or psychosis. So I'm going to talk a little bit about this book, and this is the Diagnostic and Statistical Manual of Mental Disorders. And in order for a person to be diagnosed with borderline personality, they must have at least 5 of the following symptoms that I'm going to be talking about. I'm going to talk about 9 they're found in this book, but they must have at least 5. And I'm going to sit over here for a minute. A little here by the fireplace. So the first one is they have frantic efforts to avoid real or imagined abandonment. To give you an example, let's say the husband and wife are at a restaurant that they've never been to, and the waitress talks more to the husband than to the wife. So she might just be, being nice. But after the waitress leaves, the wife starts a big fight. You were flirting with the waitress, or you're gonna run away with her later or tomorrow and making a big scene about something so simple. Another symptom is a pattern of unstable and intense relationships. At the beginning, they have idealization and then devaluation. And what do I mean by idealization is at the beginning, everything is wonderful. You're the best thing that happened to me. You're so sweet. I adore you. You're awesome. And out of the blues for nothing, the devaluation comes. I hate you, you're no good, you don't care for me, you're not good enough. And this can happen within minutes, almost like a split personality. They could just switch like that. Also, a poor self-image, an unstable self-image, which also means low self-esteem. They don't feel they're good enough, they're not pretty enough, and like nothing's ever enough for them. And they must also have at least 2 of the following addictions. It could be overspending, going shopping and just buying a lot of things because, it makes them feel good to shop, so they overspend even though they can't afford it. Some have substance abuse, whether it's alcohol, drugs, or smoking, any, overusing any of those. Reckless driving or binge eating are also some of the other symptoms. Sometimes when it's more severe, there is suicidal behavior. They think about killing themselves, so they make threats that they're going to kill themselves. Some of them do kill themselves, at least 10%. And others have self-mutilating or self-cutting behavior, whether it's with a razor or a knife, and then they cut themselves, especially where no one can see. Unstable moods lasting hours or days. They can go from really, really happy to really, really sad. Chronic feelings of emptiness, always feeling empty, always feeling bored. And then inappropriate anger, having a hard time controlling their anger and looking for physical fights or to hit someone. There can be paranoid ideation or dissociative symptoms, and what this means is they can lose touch with reality and start hallucinating things that are not there or seeing people that are not there and have some kind of hallucination. So they lose touch with reality. It's good to have compassion towards them and advise them to get help, because there is help. It's possible for this to go away, but with some extreme deep therapy and an experienced therapy. Cutting oneself is not normal. I heard there's a lot of videos of people cutting themselves on YouTube, and that is not normal behavior. That is not acceptable. We should not let someone, cut themselves and think it's okay and say, oh, it's okay. It's not okay. There's healthy ways to deal with pain and with trauma, and therapy is one of them. There's also medication, but therapy is the most effective one. So if you know someone, it's good to give them some help. Anyway, this is my small presentation on borderline disorder for my abnormal psychology class. I hope you enjoyed it. Thank you.